Welcome to Health Miracles. Did you know a stroke, also called a cerebrovascular accident, CVA, is a very scary event? It happens when the blood flow to the brain is blocked or stops. This is called ischemia. When this happens, the brain stops working right, which can affect your muscles, reflexes, and senses. A stroke is a serious medical problem that can hurt a person's quality of life and health. Recognizing the early warning signs of a stroke can help you act quickly to avoid serious consequences. This video explains 10 warning signs of a stroke, along with tests to detect it, risk factors, and symptoms. Knowing these signs can help prevent major health problems and improve your chances of recovery. Strokes happen often, but there may be warning signs as early as a month before. Here are some early signs of a stroke that you should not ignore. 10 warning signs of a stroke to watch for a month before. 1. Numbness. A person might suddenly feel numb in their face or lose feeling in their hands, feet, arms, legs, or other body parts. This numbness can feel like tingling. Often, one side of the body goes numb while the other side is fine. You might see them touching, massaging, or shaking the numb areas. 2. Confusion. A person might suddenly not understand what's happening or have trouble thinking clearly. You might notice a confused look on their face, trouble focusing, or difficulty making decisions. 3. Difficulty understanding. Similar to confusion, but here a person might have a hard time understanding speech, language, or numbers. You might see them wrinkling their eyebrows, shaking their head, talking less, or feeling unsteady. 4. Severe headache. A person might get a sudden, very bad headache in their head, scalp, or neck, without any known cause, even if they don't usually get headaches. You might see them touching their head, rubbing their temples a lot, or being sensitive to light. 5. Loss of balance. A person might suddenly have trouble standing, walking, or moving. They might seem to trip over nothing or become very clumsy. They could wobble around and need to hold onto things to stay upright. 6. Loss of coordination. When someone loses coordination, they find it hard to stand, walk, or move properly. They might suddenly seem clumsy or unsteady, like they've had too much to drink. 7. Dizziness. Feeling faint, lightheaded, or like the room is spinning. The person might have trouble moving steadily or may hold their head. 8. Difficulty seeing. Blurry vision or trouble seeing clearly in one or both eyes. They might squint, rub their eyes often, or have trouble reading. 9. Speaking impairment. Difficulty speaking, slurred speech, or using words incorrectly. It might be hard to understand them or have a conversation. 10. Weakness. Feeling weak in the face, arm, or leg. Their face might droop, they might prefer sitting or lying down, and simple tasks could be difficult for them. All these signs are important because if you experience any of them, you should see a doctor right away. These signs can happen about a month before a stroke occurs. Here are the tests used to find out if someone is having a stroke. 1. Physical examination. The first step is a checkup by a doctor. They will test your nervous system, check your blood pressure, and listen to your heart. 2. Imaging tests. These tests, like a CT scan or MRI, show the type and location of a stroke. They also help rule out other reasons for your symptoms, such as a brain tumor. 3. Blood tests. These tests help rule out other causes and can show risk factors for stroke, like high cholesterol or blood sugar levels. 4. FAST and BE-FAST tests. These tests help spot stroke signs and decide if someone might be having a stroke. BE-FAST looks for balance lost, eyesight loss, face drooping, arm weakness, speech difficulty, and time to call for help. FAST checks for face drooping, arm weakness, speech difficulty, and time to call for help. 5. Cerebral angiography. This test checks for blockages or narrow areas in the blood vessels that could cause a stroke in the brain. Here are some factors that increase the risk of stroke. 1. High blood pressure. This is the main risk factor. It can damage blood vessels in the brain and cause blood clots that lead to a stroke. 2. Heart disease. It's the second major risk factor and a common cause of death in stroke survivors. 3. Smoking. Smoking increases the risk of a type of stroke called ischemic stroke. It can lead to blood clots in the brain and harm blood vessels. 4. Lack of exercise. Not being active enough is another big risk factor. It can cause problems like high cholesterol, diabetes, and high blood pressure. which can all lead to stroke. 5. Genetics. If stroke runs in your family, you have a higher chance of having one too. Preventing stroke. To prevent stroke, the CDC recommends making healthy choices in your daily life. 1. Healthy diet. Eat lots of fruits, vegetables, and foods low in fats like saturated and trans fats. Avoid cholesterol-rich foods. You can find brain-healthy recipes to help. 2. Maintain a healthy weight. Check with your doctor to see if your weight is healthy. Being overweight can increase your risk of stroke. 3. Stay active. Exercise helps you stay at a healthy weight, lowers cholesterol, and keeps blood pressure in check. Older adults should aim for 30 minutes to 2 hours of physical activity each day. There are different activities you can try. 4. Quit smoking. Smoking increases the chances of having a stroke. It's best to avoid smoking altogether. 5. Limit alcohol. Drinking too much alcohol can raise blood pressure and increase stroke risk. Try to limit yourself to 1 or 2 drinks per day. The bottom line. If you notice yourself or someone else showing these symptoms, it's crucial to act quickly. Every moment without enough oxygen to your brain increases the risk of lasting damage. Getting medical help fast can make a big difference in preventing or treating a stroke, improving your chances of recovery and maintaining a normal life. Even if you experience a sudden severe headache without an obvious cause, it could be a warning sign of a stroke or a TIA, transient ischemic attack. It's important to seek medical attention right away, even if you think it might not be serious. Following up with a doctor promptly is essential in such cases. Thanks for watching. Recognizing the warning signs of a stroke and taking quick action can save lives. If you found this video helpful, please consider subscribing to our channel for more health tips and information. Together, we can raise awareness and promote healthier lives. Stay informed, stay safe.